Assalamu alaikum, all the listeners out there. This is Friday Night Live. Yes, indeed, it's Fahad Matin and not Abdul Akbar. I'm absolutely delighted to welcome you all to a special, exciting Health Week final edition of Health and Fitness Show as a part of Friday Night Live, taking over the Friday Night Live air. As you have heard, it is Fahad Matin, and I hope and pray that the whole week has been gone on a very nice note for all of you. And it will be going on a positive note, and hopefully it will be finishing on a positive note tonight as well. This program is broadcasting live today on 22nd of April and casting its positive vibes to all our lovely people in Luton. Our positive airways will be covering neighbourhood areas like Harpenden, Bedford and all the surrounding areas of Luton. We are also listened live in Nottingham via Radio Dawn and in Sheffield via Link FM. And and as we all know, on InspireFM we are doing this special health broadcast, and this is our last edition of the health broadcast for this week. But before we go on that broadcast, I'd like to announce the winner of the Guess the Voice competition. The winner of Guess the Voice competition is Haroon. So, congratulations, Haroon, for winning the lovely meal for two from Gourmet Burgers. Now let's come back to our the health special broadcast which we were doing this week whole week. Throughout this week we have covered different topic. Like on Monday we have covered diabetes and its management. On Tuesday we have covered mental health in Luton. On Wednesday we have covered the gynecology and IVF as a part of Beth Zindagi. On April 21st we have covered child health and well-being, which was yesterday. And today we are covering the last hour of Friday Night Live. Now, the topic of the show tonight is a very unique topic in its own, and to be honest, the way we are covering is that we are we are unveiling it in a second. But if you like to be part of this show, you are more than welcome to give us a call on 01582 481822. You can send your questions via text messages or WhatsApp on 07779 481822. So, further ado, the topic of tonight is social prescription in Luton. Yes, you have heard me correctly. It is the social prescription in Luton. And we have a pleasure of having three guests tonight. Our first guest is a local GP, and he's well known to our Inspire audience. He's none other than Dr. Tahir Mehmood. Assalamu alaikum, sir.
Thank you very much, Assalamu alaikum. Thank you very much.
Our second guest for tonight is a strategic community service person from Luton Borough Council, and his name is Marek Lubelski.
Good evening, assalamu alaikum. Thanks very much for having us on.
And our final guest for tonight, he is the Assistant Director for Luton CCG, and he is none other than Mr. Paul Lindars.
Good evening. Thank you.
Thank you so much, guys, for coming in today, and thank you so much for being part of this final edition of the Health Week.
Thank you.
So, before I start jumping into social prescription, I do like you guys to give a brief introduction about yourself. Let's start with Mark, you.
Well, you put me on the spot there.
Sorry.
Thank you.
Oh.
Well, it's really nice to be here because I'm a community development worker. I've worked a fair old few years in Luton, and I remember the setting up of this community centre and the beginning of InspireFM. So it's great for me to come along here and be part of the show and to see the great work that you're doing. And from my point of view, that's what really motivates me: getting out, talking with people, improving what's going on out in the town, and making people's lives better. And that's what's really driven me. It's what's inspired me over the years, and it's lovely to come here and share some of that work with my colleagues here who are all involved in it. So Thank you very much.
Perfect. And we will be definitely discussing a bit more about that, about social prescription with you later in the show. Our second guest is Paul Lindars. So, hi, Paul. Please give us a brief intro about yourself as well.
Sure. Yep. So I work with Luton CCG. I work closely with you, Fahad, actually. My role predominantly is around supporting primary care and the development of our GP practices. Across Luton, we have 30 practices, all with very different populations that they serve, different challenges. For me, the role is around, looking at a wide breadth of things that relate to primary care. So that can be the primary care premises, clinical quality. Predominantly, we're just trying to reduce the variation and make sure that the services, the core primary care services, and access to appointments for the Luton population are as good as they can be.
Perfect. And our first guest, our final guest, is none other than Dr. Tahir Mehmood, who Salaam Tahir.
Islam. I'm one of the local GPs. I'm very much part of the Luton community. I was trained here, and I'm very privileged that I have given chance to serve the people of Luton area. And apart from my medical and clinical aspect, I'm working in social areas as well, and also I'm involved actively in teaching and training for the doctors and undergraduates.
Perfect. And also, you are our very own GP for most of the problems which we want to seek advice on for the community.
Yes, I do attend your radio as a health expert. Yeah.
Perfect. So, guys, now as we all know, the topic for tonight is social prescription. So, let me kick off by saying, what is social prescription? Marek.
Social prescription, well, it's really what it says on the tin. I mean, it's a very simple idea, which I think has been around for a long time. Many of us have been doing it quite naturally. Many GPs have been doing it, and many patients have been finding their own solutions to their own health and well-being. And it really means giving people access to non-medical forms of support to improve their own health and well-being in the community. It does take a whole range of forms. As I said, it's been going for a long time without the name tag on it. With the name tag on it, there are now a number of programs across the country in places like Rotherham, Liverpool, Newham in London. Many areas are adopting a model, but usually the model fits with the local community, fits with the local situation, the local partnership between GPs, the community, and the local borough council, of course. And the way of getting the access to the social support is really key, and also understanding why we need to give that support. And I think that's what we're going to be exploring in the show, and I'm sure you've been doing over the last 5 days. But in your look at health and well-being, because we know a lot of the problems that people are facing in our communities, whether it's diabetes, mental health, chronic COPD, chronic pulmonary disease, all of these things have got social dimensions, and the way in which people can either prevent themselves getting worse or stop themselves getting conditions like this, all of those have got aspects that can be supported in the community. So, for instance, if it's mental health, it's about whether you've got companionship, whether you've got people to talk to, whether you've got people around you who have suffered similar things, can tell you how to get out of it. Or it may be about getting physically active and just having the confidence and the means to do that. So there's a whole range of things going on out there in the community, and we need to connect patients to them. That's social prescription.
Okay. So, in nutshell, it's like doing your own thing with the general guidance, if I'm not mistaken.
Yeah, it could be. I mean, we a lot of people take on their own social prescription, but I think the difference is that people are coming through the GP's door, and Dr. Mehmood can talk a lot more about this, I'm sure, and they've got problems which, although he's got a lot of tools at his disposal, medical tools, and a lot of wisdom and experience about what heals people, his own knowledge as an individual in 10 minutes in a consulting room is limited. So the challenge is, how do we take what's going on informally when people do make those connections, a bit of advice from a neighbour or something they hear on the radio, and actually build it into a service that happens at the GP practice alongside the medical prescription. So a social prescription becomes something much more formal, much more well thought through, much more connected to providers that we know can deliver services that work, and that's really important. Ones where we can send patients without risk, and we've assured ourselves that they do provide something that's worthwhile.
I think Marek is right. Is linking the primary care resources to something which will improve the patient's well-being. This is very a unique opportunity for the Luton, and is very well evidence-based for more than few sources. It has been successful in Scotland, as you mentioned. Rotherham very well has been very, very successful over the area, and we are similar to Rotherham area population dynamics wise. So I think people of Luton are very lucky to have this at their doorstep within their community. And it is not that to take medicines, the aim is to make them more active and reduce the burden of medicine on them. And as a consequence of that, we believe that it will help to improve the health and reduce the burden on NHS and hospital attendances.
Now
That's what we're looking for. Yeah.
Now you mentioned the Rotherham area and the evidence. So what evidence of social prescribing work in Rotherham, and how do you think that this will replicate in Luton?
I think Marek is in the best position to give more evidence. I know a little bit of that. Yes, Marek?
Of course, yeah. I mean, in Rotherham, they've been running a programme up there for over 2 years, and they focus particularly on the more elderly part of the population. They've brought in a whole range of services such as advice and guidance, social clubs, fitness opportunities, physical and dietary advice, to build around the GP practice. And they have something which we're also developing here as a role, a kind of a community navigator or community connector role, who works within the GP practice but also goes out and talks to patients and connects them with the local services. So over 1,000 patients have been through that process, and it's been very well evaluated by Sheffield Hallam University. The patient outcomes, what the patients say about their own experience, are showing that it's made a qualitative difference to their own health and well-being. The other kind of impacts have been around the ability of people to get good advice and guidance so they can move on in their lives, whether it's debt counselling, whether it's housing advice, whether it's benefits. And there's another really important outcome which I think Paul will want to say a lot more about, is the reduction of cost burden on health services.
That's
so
right.
When they evaluated primary care and secondary care, people going to GPs, people going to hospitals in this cohort, what they found was that for every pound that they'd spent on the social prescription programme, they were saving between 1.4 and 3.2 pounds in the NHS direct economy, let alone the other benefits that were coming from people being happier, more, which has a long-term effect on their well-being and health in the future. Just the fact that they're active and more connected. But these are just the costs of GP time, hospital time. They were reducing as well. And with our budget situation, that's a really important bit of learning. And I think other social prescription programs are showing similar kinds of return on investment. It's not conclusive yet, and it's very difficult to prove this sort of stuff absolutely cast iron, but the early indications are, and we're doing our own cost benefit analysis here in Luton with the programme, the early indications are that that's a really significant outcome, as well as the patient benefits.
Just to add on, there's a very good evidence about social prescribing, came from different resources. There are so many papers been published on this since 1990, early 90 till I think 2016, and the papers are basically studies been carried out in emergency department, in primary care, in mental health department, in social aspects. So they all concluded that the social prescribing or social prescription or keeping the people busy in kind of physical activity has got marked impact, positive impact on their health.
So what does involve in social prescribing? And Marek just mentioned about the cost and the benefit. So how this project is beneficial for Luton population, Luton community? Because Paul, CCG has been always been targeted for many things.
Absolutely.
And whenever there's a prescribing cut, whenever there's a GP who's not giving any medication, they always targeted to CCG.
Absolutely.
So tell us, what's the benefit of Luton of this project?
Yep. So where Marek's touched on it already, really, is effectively from a GP practice perspective. So if we're thinking about the process, sort of end to end, patient start and finish point, effectively through the cycle. So constantly we're being told by GPs and practices that we've got a 10-minute consultation period. Really difficult to get through. The medical interventions that we need to put in place, let alone sort of the wider scope of the social aspect and what have you. So what this does, although many GPs know of some of the social services, if you like, that are provided in the local area, this is given a formal route. Effectively, at the point of consultation, you may have a patient that presents who has for example medically unexplained symptoms, for example, and a lot of that sometimes is driven by underlying issues that the GP just hasn't got time to uncover. So within this process, the patient would then be referred by the GP to the navigator, who's within the practice, who actually has somewhere in the region of about 40 minutes to have that sort of coaching type of role with the patient to really explore actually what might be the underlying issues. What as a patient really drives you in terms of change and affecting your own health and well-being, and then matching that to an opportunity that's available in the local community, referring on to that particular service. So effectively that navigator has a list of potential opportunities that they can send this patient on to, non-medical interventions that really could enrich their life and help move things forwards. So I think that's the real benefit.
So the non-medical procedures you're talking about, what are the non-medical services?
Well, they're really wide-ranging, and we're just we're going through an accreditation process with lots of different providers at the moment. It can range from something like if you have a patient with pre-diabetes or diabetes, where a bit more intensive exercise would be beneficial for them. What do they really enjoy? Do they like gardening? Would they like to join a walking club? So that would, although they're getting an enjoyment factor out of it, it's also helping them from a health perspective. But you also got to think about patients with mental health issues, for example. Sometimes that can be caused by anxiety. It could be financial worries, etc. And again, within this program, there's an opportunity to forward them on to people that can talk to them about debt management, give them that sort of advice and guidance. So it's thinking sort of more laterally around how to support the patient other than a prescription.
And this is the bit where I get really excited, because this is a partnership project between the CCG, the Borough Council, and the community, and we're extending this offer of getting involved in social prescription to a wide range of community-based organisations. In fact, nobody's excluded. Anybody who thinks in Luton that they provide a service, that they can provide a service that can support patients with the kind of health problems that we know we're facing in this modern age, they're welcome. We just need to work with them to go through the process so that we know that they're ready to receive the patients. And we aim to extend this out right the way across the borough, grassroots organisations up to the biggest providers. They're all on a level playing field, offering this wide range of options and opportunities, because every patient is unique and individual. Everyone's got their own set of circumstances and needs and stories around their health and well-being problems, and we know our communities are so resourceful. I mean, again, we're back here sitting. Look at this. This is an example of what community development does. This radio station. Our communities are so resourceful. They have the solutions within the power. That what we have to do is to connect them and create that sense of community. We're running a meeting, in fact, in the north of the borough next week with our first sort of network of providers. We're still very early days with the programme, but we've been absolutely amazed and really heartwarmed by the way in which groups are coming forward. So just within one community, I think we have 30 groups signed up just within one neighbourhood, all from a karate group to a walking group to arts and crafts, all who saying, yeah, we can help patients, we can do it, just let us know when you want to send them, and some of them will do it for free as well, which is the most amazing thing.
Wow, for free.
So this is a real resource that we need to connect to the health service, because the health service is our service. It's a community service, it's a national service, and the only way it's going to to work as it becomes a real health service around people's wellness, and the community, healthy Luton communities, is going to be part of that.
Now, I will definitely come to what sort of risk involved and how the service revolves and how do we identify the patients. But I do like to take Dr. Mehmood's view on how this kind of service has been viewed and reviewed within the GP land.
I think we are very excited because the GP, especially in this area, we're working really, really hard, and we had identified a gap in the services. Hopefully, this social prescribing will bridge up that gap. For example, patients coming to us with medical problems, and we know that there's something. We know that there's something missing. So, what was that missing? This was the bridge, the part of the bridge was missing. And what basically we needed someone to motivate people, to keep them actively involved kind of activity, and keep them motivate them all the time to do these things, because we have evidence that if, for example, lack of physical activity and constant stress and anxiety and depression, and has got something strong links with the heart problems, strokes, blood pressure, mental health illnesses, all these kind of things. And one of the piece of evidence is that physical activity reduces all these burdens. And we are very, very happy to participate in this project, because we believe that if this project has been successfully taken up by the community, then there will be a lot of appreciation by the community for the service provided to them, one aspect, and is going to be very beneficial for the NHS at the end. At the we assume that. So we are very happy to participate in this positive outlook project.
All right, okay. So in terms of you said people who are suffering from mental illness, like depression and so forth. So a person who's suffering from depression, for example, I'm just picking up example. So that person who's coming to you, definitely he need more than 10 minutes, and that person definitely at the end of that session hoped that you will give him some kind of a medication which will give him a quick relief straight away. So, and if you are prescribing him something like go and interact with people, person who's already been depressed, how does it take? How the patient would react?
The problem is stress and certain degree of depression is very common in the community. Every fourth or fifth person has got some kind of link with mental health problems like anxiety, stress, or depression. When we see the people and involve them in their management, and we give them choice, and we see how bad is the depression, anxiety, and it's surprising that many people, they are not very keen to take medicines, and we're not keen to give the medicine either. Obviously, there should be something which they can opt for, and that there should be, in inverted comma, was missing. And we think that social prescribing will take that place of missing. Okay, for example, I had a choice to patient to send for the counselling, and patient would take it, and I had a choice to patient to send some voluntary organisation to, for example, Wellbeing, Luton Wellbeing. I don't mind naming them because they're doing a really great service, and I had a choice of sending the people to Changing Lives. All these kind of groups will help it. But there are certain things which are very peculiar, which people they have got limited resources available, and many people with a depression, low degree of depression and anxiety, they would be better off doing some kind of physical activity, or counselling, or talking, or doing some, or involving themselves with some other kind of activities, non-clinical. Okay, so that helps a lot, like CBT, cognitive behavior therapy, these kind of things. So many people, they when we involve them in their care, they choose not to take medicine, and they say the second option or third option is available. So social prescribing is one of those examples that we believe that will provide those second or third options for them, and hopefully it will be having a positive impact on patients' life.
So Fahad, I think it's worth saying at this point as well, it's not an either or. This is an addition. So effectively, there are clear sort of clinical guidelines, particularly around depression, etc., that will be offered and followed. But this is also another opportunity to help to support the patient in parallel with that as well. So as Dr. Mehmood said, effectively, a patient may choose not to go down the route of the national clinical guidelines in terms of the medication that's on offer. So this, may support that patient in that circumstance, but obviously, going to try and encourage patients to take up on board in line with the nice.
It's that encouragement as well, isn't it? Because patients often they want to make the change, but it's a matter of confidence, and it's a matter of they don't have the confidence to connect with going out to an art therapy group or a walking group. So the community navigator is the key to that. They can provide much more in-depth support, and they can give them the confidence that this group is there, it's ready to receive them, it's had great results in the past. I'll even go with you and help you do it, or find a volunteer who will do that. And we're already seeing from our early sets of patients that people are making that transition and not having to make the choice for medication if they don't want to.
I hold that thought, and because we are about to approach a break time, once we get back from the break, I will definitely get your views about Community Navigator and find what risk involved from Paul and how Dr. Mehmood make time to do all these extra work. But all these things after the break, so please don't go anywhere. We will be right back after these short messages. Assalamu alaikum all our listeners out there. This is Friday Night Live. This program is broadcasting live today on 22nd of April, and casting its positive vibes to all our lovely people in Luton via InspireFM. Our Positive Airways is also covering live in Nottingham via Radio Dawn and in Sheffield via Link FM. I'm your host Fahad Matin today, not Abdul Akbar. Just covering him for just today, because I'm covering this as a part of a special Health Week broadcast, and today is the final show of the Health Week broadcast. As I've mentioned in the beginning of the show, throughout this week we have covered different topics like diabetes, mental health, gynecology and IVF, and child health and well-being. And today is the show about social prescription. Joining me as a guest in this studio is three lovely guys other than myself, and they are Dr. Tahir Mehmood, the local GP from Luton CCG, Paul Lindars, and from Luton Borough Council we have Marek, Lubelski. Good evening, guys.
Good evening.
Thank you so much. Thank you so much for this lovely first half hour of the show. Not half hour. This is the final half hour of the show. And before we went on break, we were talking about Community Navigator, Marek, and you have mentioned about the Community Navigators are there, and you can use their help. And definitely, I do like to touch bases on what sort of risk involved from Paul, and I do want to know what sort of how doctors like Tahir Mehmood can make time for us and be so active in the community. Let's start with you, Tahir bhai. How do you make time for us?
One thing is
and be active for the community.
Oh yeah, it's the being general practitioner is not a job. It is a kind of passion, and either you be a GP or you can't be a GP. So once you opt or choose to become a GP, then you have to take the whole package.
Mm-hmm.
One of the packages is that you have to educate the people, you have to look after them, clinical, non-clinical things, and you have to do a lot of things. Now the general practice has changed. It's very highly competitive. Quality is really, really high. All the CCG managers are sitting down here, they know that. And we have to be accountable for all these kind of things. At the same time, you have to think forward.
Mm-hmm.
And what's happening in next year, couple of years time, and all the and during the work, your brain is not a part of brain you're working, the whole brain is working.
Mm-hmm.
Like if I'm in a kind of special department, so only that part of brain will work. For in cardiology, only my cardiology part of the brain will work. But in general practice, the whole part of the brain is working and is bubbling and keep motivating me. So that's my passion. So
that's how you are involved.
That keeps me going.
And luckily, with this project, social prescription, you will have help of a social navigator, which Marek will explain a bit more, as in what is social navigator and how this will be helpful for GPs.
Sure. Well, it's a really important part of the process to have a community navigator, because what we've just heard about, the GP's time is so precious, and there are so many demands, and we need their skills to be right where they're needed, which is with patients and around their clinical prescriptions. So the navigator complements the work of the GP, part of the GP team in the practice, as Paul has already said. That's really important that they're in there right from the beginning. And when the GP identifies that there may be some opportunities for social prescription, for some community activity that might help to alleviate the health and well-being, either as something complementary or as an alternative to medical prescription, then the patient can go and talk at much more length, as Paul has said, with the community navigator. Now, these are special people, navigators. We've got a couple in Luton already that we're just developing the program with, and they have to be very strong on people skills. They have to understand the kind of fears and problems and issues that people face in their everyday lives, and have the time and the empathy to explore those with people, so they can get to understand what their hopes and their fears are and their ambitions, all within a short 40-minute consultation. But believe me, the people that we're getting, they can do this. Mm-hmm. And then just very simply say, what are the first steps to resolving these problems? Mm-hmm. What are these barriers to your health and well-being? What are the first steps? Do you need some advice for this particular area, whether it's family, whether it's debt, whether it's housing? Do you need just to meet people who are interested in the same thing? Do you need to get out? You need to see some green space? Do you want to join a club? And is it a combination of all of these things? As we said before, each patient's unique, each person's set of health and well-being challenges is unique. So it's about finding the right pathway and connecting that patient to the right solutions in the community. And as we're increasing in our community development work from the Borough Council, we're seeing, as I said earlier, this wide range of opportunities and resources opening up from within the community, being offered to people who are suffering, and the skill of the navigator is connecting that individual to the opportunities and giving them the confidence to do that.
Mm-hmm. Now, one other thing, being a person from Luton Borough Council, you know that we have more than 200 different sort of communities, languages spoken within the community, and not everybody is quite, they can speak English, but they are not prone to understand English fluently or understood what has been said. So how these community navigators will navigate with the problems of languages itself?
That's a great question, because obviously we don't expect them to speak 125 different languages, and it would be impossible. But what I think, it comes down to the resources in the community, because the only way that some of the language support that they're going to need to make the translation for people who can't speak or express their full needs in English is going to be using the resources of the community who share those languages. So we're going to bring them in. CCG has a certain amount of commissioning resources for translation services, but I think there's a huge amount of voluntary support out there as well, with people who will be able to connect and counsel, and then of course it's about the provision. So I was talking just earlier about a particular community group from a migrant community who've been coming over to Luton. Some of them have been suffering some of the post-traumatic stress that these communities do suffer from the war situations they've been in, and they're not yet connecting with services. And in many ways it's about supporting those communities themselves to organise, to provide the same language service that they can for their own patients and clients, and then connecting them to the practice. So there's a lot of work to be done, both out in the community and within the practice, to explore those cultural issues and dimensions and get the support. I don't think we can resolve it, and we're going to come up against a lot of issues and barriers, but it's about engaging the community to enable that to happen.
Whenever there's a risk involved, and as soon as the risk said, CCG names comes in play as well. So Paul, tell us, enlighten us, how does the risk involve for this particular project?
So I guess it depends on whose perspective you're looking at this from. I mean, ultimately, in terms of risk. So if we think about from a patient perspective, for example, then I don't see a risk in terms of the way that we managing this piece of work, the programme, etc. Effectively, these are opportunities communities that patients could, at any point, members of the public, walk into and refer themselves to. This is just around joining them up so that they know what's available, etc. But also through this process, it gives us a sort of a level of robustness that to assure ourselves as a system that these providers are fit for purpose. They have to go through not a too labour-intensive accreditation process, but enough to give us the assurance that, if we are referring these people on, that they're safe. They're going to be in a well looked after in the environment that they're in. So simple things like health and safety, for example, there's some bare minimum standards that we'd expect. Also, from a GP referral perspective, obviously the GP will be looking at the patient in terms of what's appropriate for this person to go on and do. Not all patients, even if it's just minor sort of activity levels, there are a minimum number of patients that might not be appropriate for. So through the referral process, that's made known to the navigator. The navigator and the GP work very closely together anyway. So, between the two of them, it's not just a referral on a piece of paper, but it's a dialogue. It's around actually what's really going to work for this patient. So from a patient perspective, I don't see risk. From an organisational perspective, from the CCG and from Luton Borough Council's perspective, obviously there's some money to pump prime this that's going into the system, and actually, although we say there is evidence, but nationally this is quite a new thing, and actually the way that we're going about it in Luton is slightly different to anywhere else as well. So there's a minimal risk that the money is going towards this, and ultimately what we're looking to do through this process, and we're going to talk a little bit about how we're going to phase it out, etc., going forwards, but we manage that risk by measuring as we roll out how we're going, anecdotal feedback, and then some harder evidence coming through as well. So
Perfect. You are listening to Friday Night Live. If you have any questions or queries regarding our topic for tonight, please give us a call on 01582 481822, or you can send your views or your questions via 07779 481822, either text message or WhatsApp way. Today we are talking about social prescription in this final hour, and we are talking to a doctor and two people from Borough Council and Luton CCG. Now, please, is there any evidence so far in your last the phase you have rolled out, and what are the phases you are thinking of rolling out? So Marek, enlighten us how you are taking this project and which part of the project we are in at the moment.
Yeah, thank you. Well, we're very early days here in Luton, and we're taking a measured approach. We don't want to rush into this because it's a complex project. It involves a wide range of stakeholders, and of course we've got the health and well-being of patients, at heart in our care, and we have to make sure it works. So there's a number of aspects that we've got to get right, and we're developing a model, and it's already being changed by the input of GPs, by the input of patients. We've already consulted with over 250 patients just on what they see as the key design elements of a program like this. But we have had our first 50 patients coming through already. We're working in 4 GP practices across Luton, developing the model, and the early indications are, and we evaluate from a patient perspective on 2 areas. That first of all, physical activity, because we know that's such a crucial indicator of health and well-being, whether it is diabetes, mental health, or any of the other ones. It just works for people to get more active, and you've been exploring that in your shows, I know. But the other thing we also measure is their own perception of their mental state, and how happy and well they feel in themselves, and how connected they feel to others, and so on. So we're checking that out as they come into the navigator's practice room in the interview, and checking it out after 12 weeks on the program. And the early indication is that we're seeing improvements and benefits. We're also getting patient stories, and I was talking with our navigator this afternoon actually just about that, and she was telling me about the kind of people coming through with anxiety, depression, agoraphobia, fear of going outside and being with others. And this one particular patient, the key for her was to get involved in a local art therapy course, and this gave her the confidence then to join a walking group she got involved in the walking group, and she kind of identified with somebody on that walking group who was a group leader, who suggested that she get involved and train to be a volunteer herself so she could lead walking groups. And she's actually starting to go through that training program herself. So just within 12 weeks, you can see the difference from somebody who comes in, mental health, anxiety, depression, agoraphobia, into the GP consulting room, and coming out the other end, they've got something to do, they're engaged with others, they've got some purpose, and purpose is such a key thing when it comes to health and well-being. You know, the connection with others, the ability to go out and just do things, and the purpose, the desire to be involved, and the feeling that your life has a meaning and a contribution to make. That's crucial, and volunteering is a great way of doing that. So sorry, I've been sidetracked a bit, but we just love these stories that come through.
Because during the break, I receive a phone call in front of you guys,
Yes.
and there's a sister who did do not want to come on air live, but did mention that she's suffering from anxiety and depression, and doctor did prescribe him some medication, and she do not want to take the medication. So what can be the best route? And I think so, Dr. Mehmood, you are the best person to answer the question in that respect.
I can give you a general answer.
Yes.
But not on the specific in this case.
Definitely, this is a general discussion, and we are not taking any specific advice for that.
That's right, because every individual is different, medical background is different, and the conditions are different. The social prescription does not replace the acute kind of treatment. That should be very clear. The second thing is there are some part of social prescriptions that already exist in the community. For example, talking therapy and counselling sessions, and these are going to be a part of social prescription. It is a part of social prescription, and they already exist in all the general practices. And the GPs, they know the patient. They really they know well that way to refer. I can't comment that someone has got mild depression or panic attack or anxiety, how to deal with it. I think the best thing is to speak to own GP and take the GP's advice or own doctor's advice about what's the level of anxiety, depression. As I clear that the social prescription is not to replace any kind of medical treatment. It is augmentation, or you can say is a bringing link, or it is not even replacing the medicine. It is to help those people who have got some kind of problems which can be treated by physical activity or other than medicine. So in that particular case, I'm not able to comment, but I will strongly advise to speak to own doctor.
Like a holistic approach kind of thing.
Yeah, holistic approach does work in a lot of cases, but it has to the background of the medical problems, individual, and because the individuals have access to their own GPs, and GP has access to their own medical record. So that's why it's very important to take the advice what the GP suggests.
Okay. Sorry, you were sharing something else as well.
Well, we were just talking about where we're going with this program. So as I said, we're very early days, but we're encouraged by the feedback that we're getting. What we're going to do once we've got the model right, and part of the model includes introducing a little bit of an IT solution, a smart card, which people will get when they get the prescription. They can go out to their community providers and swipe the smart card, which will then give them a means of tracking their activity. The GP can see what they've been doing, the navigator can track it, the evaluators can track it, and all of that will give us a much better picture of what's happening across the social prescription system, and how what services are working and why they're working. And also, if people don't turn up, we can quickly follow up and say, what's the problem, can we help at all? So we've got to get that in place as well as part of what we're doing. So over the spring into early summer, we'll be developing this model and getting it right, and then I think we'll be back to the CCG and to the GPs and back to the Borough Council and saying, okay, this is what we think it's starting to look like in Luton. How do we start to really roll this out across all the practices over the next couple of years? Because it is resource intensive. It does require investment up front. We know it will save money in the long term, but we have to find those resources. We have to have the know-how to do it. We've got to talk with our GPs. We've got to recruit navigators and develop them. And of course, we also need the opportunities in the community. And whilst there is wide range of services out there, the kind of need that we are potentially tapping into is great. I mean, at any one time in Luton, you might say 1 in 4 people are suffering mild to moderate mental health problems alongside other long-term conditions, just as an example. So, we have to manage demand to some degree and be sure that if people are offered this service, that there are places for them to go, and we have to develop that capacity and that range of choice within the community sector, so that those opportunities can be made available.
I think. Sorry, just what Marek says is this is also a great opportunity for the community to develop themselves, the voluntary sector, and there's a lot of demand of, as you mentioned, the multilinguistic problems. For example, what I and the other doctors they are facing, that the people who need counselling, talking therapies, we don't have people speaking in Urdu, the professionals, or if they are speaking Urdu but they speak in English, and the people who need counselling, talking therapies, their demand is in different language. For example, if I speak multi-languages, so it's easy for me to relate with the patient, and I can help them, and people, they like it if you speak to them in their own language, and they feel very confident. So similarly, this opportunity might be helpful for our community leaders to think about what kind of community services we need, and also the people who are listening to this program, and if they're professional and if they're wanting to do any help, they can be a part of this project when the need rise. And also they need to think about how they can help the community in the long term basis. People come to see me in general practice, I ask them what they do, why they're educating themselves in that university on that particular topic, and ask them, do they know the community needs this kind of services? Like physiotherapists, occupational therapists, counsellors speaking Urdu, Punjabi, Pahari, Hindi. We really psychologists, we all need all these kind of services. They can relate with the patient and they can benefit for the patient in the long term.
So in terms of the practices, you have mentioned that it's been rolled out into few practices, and you mentioned, Paul, there are 30 practices out in Luton. So how many practices they have rolled out, and what's the sort of total outcome in general?
Okay, so as we mentioned before, we've got 4 practices involved in the pilot. They're all at different stages in terms of engagement, etc. And a lot of that is dependent on. So again, we need, because we're working up the networks that surround the practices, that takes time. We need to then, as we roll out, we're thinking about actually the populations of the practice where we're going to get the best return. So when we're investing time and effort, where's the real need in Luton, and that will help shape the practices that we choose and we roll out to as we go forwards. But as I say, I think for us it's around getting it right with these first 4 practices initially, taking stock, evaluation, and then the rollout program will come following that.
Okay, and who will identify what patients need these kind of referrals, and how these kind of referrals will be monitored? So enlighten us with those things as well, please.
Yeah. So again, we can talk about this.
This is to the whole floor.
Yeah.
Okay. Please pitch in.
Yeah. I mean, ultimately, so as we sort of said before, there are 4 sort of key areas, if you like, that we're starting off with. So it's COPD, which is a respiratory disease, diabetes, pre-diabetes, and obesity, which is linked to that. And then obviously we've got people with mental health issues, and I think something that we haven't talked about much at this point is carers. Actually, in terms of the support that carers offer to patients is absolutely huge, and it's a resource that we really appreciate, but sometimes always don't necessarily demonstrate that. So this is around, actually, if you are a carer, it's demonstrating that you're important to the system. We appreciate that, and actually as a GP you can pick out patients from these sort of broad categories effectively, where you can see that there are non-medical issues, and actually that would be the starting point for the referral to the community navigator.
Because of course carers' health is often at the highest level of risk because of the responsibilities, the additional work that they take on. So it's really important that we support them and prevent them getting any worse if they're caring for somebody with a long-term condition, for instance.
So how does it involve people who are suffering from diabetes, or a person who's suffering from asthma? How social prescription will be helpful for these people?
So again, I mean, if you think about sort of diabetes, for example, then it's a known fact. There's evidence that if you have diabetes, you're more likely to suffer with a mental health condition, anxiety, etc. Ultimately, for them, it could be anything from dealing with that anxiety by being able to get out, not being socially isolated, being able to mix with groups, etc. Increasing their activity levels, that's absolutely key as well. So, we know that we've seen, for example, patients that are diagnosed with pre-diabetes, i.e. they're not diabetic yet, but if they carry on as they are, they could well go on to be, where they get these activity programs, they increase their activity, and they turn things around, and actually they see there's a backwards step where actually they move away from being pre-diabetic and no longer need that intervention. So that's really crucial.
And finally, I do like to take your views as well, Dr. Mehmood, that how this project is different from the ones which have been rolled out in the past.
The project which is rolled out in the past, I'm not aware which one.
There's similar kind of projects been rolled out in the past where like weight management program and so forth. So how come social prescription? Is it part of the similar kind of a thing, or is it slightly different than?
I think social prescription is slightly different. It's going to be partly streamlining those little kind of voluntary sectors or the non-clinical aspect of the treatment. It is streamlining. I would say that, but they are doing a great job. So we've got a lot of community work already been going on. This social prescription, I don't think is going to replace them, but obviously this is going to be a unique kind of programs which will link the community with general practice, Luton Borough Council, as Marek mentioned in the past, and CCG working together. This is going to be.
That's the crucial thing, that we've got the community navigators making that missing link to the community-based organisation. And I think there's also another aspect which is about the patient being at the heart of it. So patient choice is crucial. In previous times, perhaps we've said this is where you need to go. Now we're saying, okay, where do you want to go? And we're also saying to the community, what can you provide? Because there are solutions out there which are new and innovative.
Perfect. Thank you so much, guys, for coming in today. Thank you so much for the best guest for me tonight. This was Friday Night Live. As a part of the Health and Fitness Show week, and thank you so much for all our listeners as well for tuning in and being part of this show. If you have any comments, please give us your comments on our studio lines, or if you have missed any part of the show, you can always go onto our podcast and listen it via website, or you can listen to the repeat broadcast which will be done tomorrow. Until next time, I'm your host Fahad Matin signing off.